You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is an expert on the topic, board-certified oral and maxillofacial surgeon, Dr. William Dobbin. Dr. Dobbin, welcome to the program.
Thanks, Randy.
Now, before we get into today's topic, tell me a little bit about your practice. What kind of patients do you see?
Well, as an oral and maxillofacial surgeon, I treat various conditions of the mouth and face.
Okay.
My typical day in the office consists of removing impacted wisdom teeth and placing dental implants. I also rebuild the bones and soft tissues of the jaws to accommodate dental implants.
Okay.
Then there's the other part of my practice, which is hospital-based, where I do orthodontic surgery to improve a patient's bite.
Which hospital?
Elliott Hospital in Manchester.
Okay.
Do cleft lip and palate surgery and treat facial injuries.
The cleft lip and palate, I understand you go to South America a couple times a year.
Yes, that's true.
And what do you do there?
Do cleft lip and palate surgery on the indigent.
Just volunteer a couple weeks out of the year?
Usually about 3 weeks a year.
Okay. Now, and tell me if I'm pronouncing this right, maxillofacial surgeon. I mean, what does that mean? I mean, what area of dentistry is that?
Well, we treat all different deformities of the head and neck area.
Okay.
So anything from a patient that has cancer to...
So anything having to do with bone? Is it more about the bone?
It's bone and soft tissues of the face.
So as an oral maxillofacial surgeon, you're the one that does the surgery, places the implants?
Yes, I place the implant, and then the restorative dentist places the prosthesis on top, whether that be a
Seems
crown.
very painful, by the way, the thought of an implant going into the bone.
Really, it's not at all.
So they don't complain about pain?
No, the bone really doesn't have any sensation whatsoever. It's really the soft tissue.
Okay.
So if you minimize the trauma to the soft tissue, the patient has little to no pain.
Okay, now what's changed over the last 20 years? Because you say a lot has changed in 20 years in regard to dental implants.
One of the big advances is that they've changed the texture of the implant so that the total treatment time is greatly reduced.
How so? I mean, you know, the design of that implant, how does
the bone takes to the implant a lot quicker, so it only usually takes about 6 weeks for that implant to take to the bone, whereas before it used to be 6 months to a year. Imaging has changed greatly in planning dental implants. Now with the use of the iCat X-ray.
That's a CT scan?
It's a CT scan that's done in the office.
So that's in your office?
It's in my office.
Okay.
And the advantages for the patient is it takes a lot less time, it's less costly, and there's a lot less radiation than the CT scan done in the hospital.
Now you say it used to be almost like a blind procedure to find bone. Is that a fair statement?
Yes, because you used to work off of a model to plan your surgery and looking at two-dimensional x-rays. Now, in using this CT scan that we have in the office, I can plan the surgery on the computer with special software, so it simulates the surgery. And utilizing that, I send that data to the lab, and the lab makes a surgical splint. So it's actually a surgical guide, so that there isn't any guesswork done in the procedure whatsoever. So what you see on the computer you've planned is actually what you get in the mouth. So there's less trauma to the patient. You don't have to raise big flaps of tissue. It's right on the money. You don't have to worry about endangering any adjacent anatomic structures.
When I see, you know, anticipating this interview, when I see information on the web about, you know, get a fixed set of teeth in one appointment, is that possible?
Oh, it definitely is possible with the advent of the CT scanning and the computer software that we have right nowadays.
So a denture wearer could go in, if they have a CT scan, plan the surgery, give them a fixed set of teeth in one appointment.
Within an hour.
Within an hour.
Within an hour.
Because when I read that, it seems like an exaggeration.
No, it's not.
Are there a lot of misconceptions in the world of dental implants, and if so, what are they? What do you hear?
They're painful, for one. As I alluded to before, they don't have to be painful if you minimize the soft tissue trauma. 2, they take a long time. They can be loaded right away with the type of treatment that we have. They're very expensive. They don't have to be. You don't need an implant to replace every tooth in the mouth. You can place 2 implants to stabilize a denture.
What about age? You know, my mother, you know, we're talking about, I said, hey, look, I'm interviewing a doctor about dental implants, and she's 73, she says she's too old, and that they would fall out. And we talked on the phone, of course, and you said that no, that's not the case.
No, age is not a contraindication whatsoever. I've done patients in their 90s.
Really? Now, why would a 90-year-old want to get
quality of life issue?
Okay.
They're dissatisfied with their denture. They can't chew, they can't speak, they can't laugh, they can't sing, they can't kiss without fear of that denture being moved.
Now, you say that you're changing people's lives with dental implants. I mean, do you hear that?
Oh, without a doubt. With a minor surgical procedure, I can change a patient's life dramatically.
What do they tell you? I mean, did they tell you that after the procedure?
Well, they tell me before the problems that they have in wearing a denture.
Like?
They can't chew their food. They can't speak. They can't laugh, sing, kiss without fear of that denture.
So is that fear? I mean, they tell you that the fear that it's going to come out is very common?
Oh, it's very, very real. And all of a sudden you give them a prosthesis that's fixed in their mouth so they can chew whatever they want. What's that going to do? Their diet's going to improve, their health is going to improve.
So they avoid certain foods when they're wearing a denture?
Well, they mince up their food or they go on a liquid diet.
Now, if it's as good as you say it is, getting dental implants over dentures, why isn't everybody doing it? On the internet, it says 15 million people either have an upper or lower denture.
Most people don't know about it.
I just don't know, really. Okay.
People are fearful of it. They're misinformed. They're not informed.
So the biggest fear is the pain.
Without
what
a doubt.
I mean, what do they take on the way home? Do you give them an ibuprofen? What do you give them?
I always give a narcotic, but oftentimes they only need an ibuprofen.
So what are the different categories of dental implant patients that you see?
Well, you have a patient that's missing one tooth, or you have a patient that's about to miss one or more teeth. You have patients with old failing dentistry in the mouth, whether it be in the front of the mouth or in the back of the mouth. Mm-hmm. You have a patient that they've seen their dentist and the dentist has said
teeth have to go.
They have to go.
So
and
it's
they need a
dentures or dental implants. All right.
And there's the old denture wearer that's dissatisfied with the fit of their denture. And there are patients that have had dentures for many, many years and they're very dissatisfied with their denture.
Let's talk about the one tooth. I mean, why get a dental implant? What's your case for why a dental implant over just what's traditionally done in dentistry for missing one tooth?
Well, traditionally a bridge is what's placed, and that means where they have to shave down the adjacent crowns on both teeth. Okay. With a dental implant, you don't have to do that, so you're saving tooth structure. Two, with a dental implant, you're preserving the bone. When you lose the root of a tooth, the bone resorbs or wears away. With a dental implant, that won't happen.
So if the bone's going away, do the rest of the teeth get loose? They cave in around that missing spot? I mean, could that potentially happen?
That could potentially happen, plus the aesthetic result is really bad, because if you have a bridge where the lost tooth is kind of resting on the gums initially, and all of a sudden the bone resorbs away underneath it, the aesthetic result isn't going to be there. The longevity of an implant is far superior to that of a traditional bridge as done in the United States. The median age of a bridge in the U.S. is only 7 years, 50% more, 50% less, whereas an implant can be 40 plus years.
I mean, can it last? So can it last I mean, forever, really?
Forever.
I mean,
forever.
So there's, I mean, implants out there that have lasted 40 years.
It's definitely true.
So when I hear they fall out, because I was talking to a doctor about this, a medical doctor, and he says, I don't know, I think they fall out. I mean, that's just not the case?
That's not the case if they're done correctly, and if they're loaded correctly, if the restorative dentist does a good job, and also if the patient takes care of it.
Okay, so is it less expensive, though, in many cases with everything that's done to save a tooth in dentistry? You know, root canal, failed root canal. Is it less, especially on the single tooth? I mean, could it be less to just give them their tooth back with a dental implant?
It could be less for the long run, because you don't have to replace the existing structure over and over and over again.
Okay, now what about people that are missing like 3 and 4 teeth? You say this is a big part of the people that could benefit the most from dental implants.
Without a doubt. What do they have as an alternative? To do another bridge where they have to shave down several teeth or have a removable denture, which, as we all know in the clinical field of dentistry, that loosens the adjacent teeth.
Okay. So
by placing these root form implants in the jaws, you're stabilizing the bone level and you're not jeopardizing adjacent teeth.
Now, of all the people, I mean, millions of people with dentures, I mean, it starts somewhere. I mean, are these people headed for that kind of disaster, as they say, if they're missing 3 and 4 teeth in the back of their mouth? I mean, does it usually lead to just, you know, more and more?
Without a doubt.
So there's science behind that. I mean, statistical information.
Without a doubt. Without a doubt, because teeth will eventually fail underneath the bridge. As I said before, the median age is only 7 years. You get recurrent decay, you get periodontal disease. If you have a removable partial, it rocks the teeth out of the mouth. So they do march towards dentures.
So the denture wear. That
probably is the group that we can help the most.
I mean, do they hate it? I mean, do you hear that they hate it? Because I know people with dentures and I don't hear any complaints from them. I mean, are all, for the most part, denture wearers unhappy with their situation?
I think if they were really honest with you and with themselves, nobody wants to really lose their teeth.
Let's go through the different options then. We're going to take a quick break. We come back. The different options, and you brought some models, the different options that denture wearers have. I guess from as little as 2 dental implants.
Correct.
Something snap in, snap out. Okay, so we'll talk about that. Also the process. What somebody can expect on day 1 of the process. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Up next, if you are a denture wearer, what you need to know. We'll be right back.